Good afternoon. My name is Dennis Wieboldt, and I'm a BA/MA candidate at Boston College. I'm also proud to serve as the chairman of the Boston Intercollegiate Government. First founded nearly 2 decades ago and recognized in 2003 by the City of Boston as an effective means of advocacy for greater Boston area students, the Boston Intercollegiate Government, or BIG, represents over 60,000 undergraduates in the greater Boston area. As a coalition of undergraduate student governments, we sponsor student-centered civic engagement events and advocate for student interests on local, state, and federal levels. I'm before you today on behalf of the BIG Committee on Governmental Affairs to recommend amendments to H.2120. For those who are not familiar with this legislation, it would establish a Massachusetts Commission on Suicide Prevention and Mental Health Crisis Management. On the whole, H.2120 is a good bill, but from our perspective, the proposed commission's lack of explicit attention to college-age students' mental health needs is an oversight that can and should be rectified. As introduced, the commission would have a fairly broad scope, but it would not be required to examine the mental health needs of the Commonwealth's college-age population. Similarly, H.2120, as introduced, would not require that any of the commission's members be of college age or have expertise with college-age students' mental health needs. As such, we'd ask that 2 amendments be made. One which ensures that college-age students are appropriately represented on the commission, and a second that ensures that college-age students' needs are, in some way, addressed by the commission. These 2 amendments can take different forms, which I'm happy to discuss if any of you have questions, but they're both oriented around the same goal: ensuring that the needs and perspectives of college-age students are considered in conversations around mental health and suicide prevention. Why is this necessary? Let me give you just 2 statistics. According to a report from the Department of Higher Education, there are nearly 500,000 students enrolled in colleges and universities in Massachusetts. And according to the Centers for Disease Control and Prevention, 1 out of 4 young adults between the ages of 18 and 24 consider suicide during the summer of 2020. My time today is limited, but the fact is that Massachusetts has a very large population of college-age students, a population that has particular mental health needs, especially in light of COVID-19. Our amendments will help to make sure that this population is not overlooked by the Commission, and the importance of assessing this population's needs should be particularly apparent to the Legislature, considering that, for example, the Department of Mental Health offers adult services for those over the age of 19, but without our amendments, it's unlikely that the services that could possibly be accessed by college-age students would be meaningfully reviewed by the Commission, not least because the quantity of services in this category is relatively small when compared to others. On behalf of the BIG Committee on Governmental Affairs and the 60,000 plus students that we serve, I urge you to support H.2120 with the amendments I've described. Please take advantage of this opportunity to ensure that the needs and perspectives of college-age students in the Commonwealth are included in these long overdue conversations around mental health and suicide prevention. Thank you, Representative Mira, for your leadership on this issue, and to BIG policy analyst Kathy Nugent for her research support.
Thank you, Dennis. Thank you for giving such specific feedback on the legislation.